Hi guys, I'm Trudi. Welcome back to my YouTube channel. Today I want to talk about mentorship and do you need one as a new grad. Also guys, please remember to subscribe to my channel and click the bell so you get notified every time I post a new video. I post a new video every Sunday. Now let's get into the video. So what is mentorship? Mentorship is when an experienced grad guide or help a less experienced grad. The person might be younger or older. Age is really not a factor when it comes to mentor because you could be a younger person and the person you're mentoring is older. So age is really not a factor in mentorship. It's really about who has more experience. Now, do I think you need a mentor? Yes, because as a new grad, you're not going to really understand the ins and outs of the facility or whichever setting you're working in. And even if you did field work in the setting that you're actually working in, it's still going to be challenging as a new grad to really understand the ins and outs of the facility. Now, one of the reasons why you need a mentor is a mentor will help you to better navigate the facility. For instance, the way you practice stuff in college is going to be a little bit different when you're actually in a facility. Let's say you're measuring range of motion or you're testing muscle strength. So in college, you literally had to test every joint for range of motion. But when you're in the facility, honestly, you're not going to really have enough time to do that. So you're going to have to, basically eyeball it. It might seem weird, but if you were to do it exactly like you did in college, you wouldn't have enough time. So the way you were taught in college, a mentor will better help you. A mentor will basically assist you because if you were to measure every single joint, you would not have enough time. Because remember, you have to evaluate the patient and you have to document what are your findings. So you can't really do everything exactly the way you were taught in college. And it doesn't mean you're not given the best treatment. It just means you have to learn how to manage your time. Of course, over time, you're going to learn how to do that. But in the beginning, sometimes facilities expect you to know these things. So in the beginning, a mentor will help you to understand this. And also, a mentor can be somebody who's more experienced at the facility you're working at, because let's say the rehab director is an OT. He or she might be able to guide you, but you can't really expect that because directors are really busy. So it's good to have somebody you could call upon. If you're struggling with a note, you can call them and say, this is my findings, how do I word it? And if you're working in a school setting, it's going to be similar because you might have a challenging case where you're trying to formulate a treatment plan for a child, which it might be a difficult child to treat. So you might be unsure of what to do. A mentor will help you, plan a treatment plan. Maybe they're on the phone with you, guiding you, etc. And something that's a big part of the OT process, and that's documentation. And it's not even just OT, it's in healthcare overall. Because if it wasn't documented, it never happened. So even if you literally raise the dead and there's no documentation to show that, it didn't happen. What a mentor will do is help you to better document, specific stuff. Because remember back in college when we wrote those long treatment plans, and a lot of times we included stuff that really didn't have to be included. But a mentor will help you to be more concise, and get to the point. And also with different changes with the payment for services, you have to even be more specific of what you're doing. And as a new grad, you might not be able to do that. And the last thing you want is your note or your documentation is going to be reviewed by the state or by Medicare or Medicaid, whoever, and they find, discrepancies with your notes. So a mentor is going to be able to help you. And as a new grad, these are really things that you might not be able to understand in the beginning. And another thing too, in college, when you're doing documentation, you pretty much, write the goals, you have to formulate everything. Whereas in a lot of settings, they already have a type of software where it's kind of like a cookie cutter. So it generates the goal for you. So you kind of have to click whatever goal applies. But there are different sections where you have to do the subjective and the objective. So those are the parts you might, kind of struggle with. Because here you are in college, writing documentation one way, but then when you go to the facility, they're doing it a different way. And also, guys, you have to be also flexible because Some settings use different software or different, documentation style. So even if you use one type of documentation during your fieldwork, maybe your first job is going to be something different. For instance, a lot of facilities use Rehab Optima, which is pretty simple. But then other facilities use Casamba. So if during your fieldwork you were using Rehab Optima, you go to a setting and they're using Casamba, you're not going to be able to really understand what to do. So it would be good if you have somebody, you can call up and say XYZ. And also remember, a lot of times employers are asking for, 1 year experience, but as a new grad, you're not going to have that. So if they kind of, gambled on you and say, you know what, let me hire her, even though she's a new grad. You want to be able to, put your best foot forward. You don't want to be screwing up with the documentation because you're kind of going to make it bad for, other new grads. So having a mentor is really going to help you, to impress your boss. And, impressing your boss is not really a bad thing because you doing that is going to show that it's not so bad hiring new grads. So I would say for documentation, have somebody, you can call up. Maybe it's somebody from a previous year, I'm sure, or maybe it's an old professor. I'm pretty sure there must be somebody you can call. And just to touch back again on time management. Time management is very important because you have a set amount of time to treat the patient, to do the evaluation. So let's say you have an 8-hour schedule. You're expected to do your evaluations, to do your treatment in that time because there's something known as productivity. And you don't want your productivity to fall below a certain percentage. So managing your time is really important. So what's the verdict? I do encourage new grads to get a mentor. No, I'm pretty sure you can find somebody from, let's say, the previous class or 2 semesters who graduated ahead of you. Or during your fieldwork, maybe your fieldwork supervisor, because it all depends on the setting, because maybe you went in a pediatric setting for fieldwork, but your first job is in a nursing home or a hospital. There's gonna be so much different OTs. You can try to network online, on Instagram, on Facebook. Try to find somebody. It's probably gonna be easier if you find somebody who, graduated maybe a year ahead of you or 2 semesters ahead of you, however long. Find somebody. It's not like they have to be meeting with you like every week, but find somebody who you can call them, you can vent to, you can ask questions, how should I do this? Any suggestions? I'm pretty sure you will find somebody who will be more than happy to assist you. So I do encourage you to find a mentor, find somebody. It could be your professor, as I said, a past graduate, your fieldwork educator, whoever it is. Find somebody who you can, talk to sometimes about what's going on in the facility. What are you struggling with? Because it might not be the easiest thing to talk to your director because, as I said, directors are very busy and they might not really have the time to really sit you down and train you to do XYZ, because this is something in rehab that I wish was different. But for the most part, with nursing, they'll, have them do like a 2-week orientation and stuff. You'll really find where, they have an extensive orientation process where they kind of walk you through whatever. That's really not the norm. So be prepared to go into a facility where you're not too familiar, but with a mentor or somebody you can call upon is going to make it so much more easy. Okay, guys, I hope this video was helpful. Thanks so much for watching. And guys, please drop in the comments, what are your thoughts about mentor? And if you're an OT or OTA and you're available to mentor somebody, maybe you could just drop in a comment your contact information. And also, guys, remember to subscribe to my channel and click the bell so you get notified every time I post a new video. Thanks so much for watching, and I'll see you in the next one.